Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. As of 9:30 a.m. Today, we have 181 new cases of the virus being identified since last Friday. So this includes 87 cases on Saturday, 63 cases on Sunday, and 31 cases to report today. Current 5-day test positivity rate is 5% provincially, 4.1% in Winnipeg. We have 2 additional deaths since last Friday, and I'd like to extend my condolences to their family, friends, loved ones. Dr. Attenwall and I have both shared data regarding hospitalizations and vaccinations. In the month of June, there were 412 hospital admissions. This is 45% lower than the previous month. Of those admissions, 74% had no vaccine dose. 22% had 1 dose, but the positive test result was within 2 weeks of that dose. 90% of those, or 90 of those 412 were admitted to ICU, and 77% of those ICU admissions had not a single dose of vaccine. 3% had 1 dose, but the positive result was less than 14 days. So again, we don't bring this up to blame or to shame anyone or to blame anyone for the reason of their illness. We're here showing the power of vaccine, that we see very few people being admitted to hospital, really even after a single dose, but especially after 2 doses. We see the power of that vaccine in preventing severe outcomes. And that's what we've been really focused on throughout this whole pandemic, is to not have those severe outcomes, to ensure our healthcare system is there for all Manitobans. And as we see less and less Manitobans that are unvaccinated, we're going to expect to see that translate into less and less need for hospitalizations and ICU admissions and these severe outcomes. So this is why we report this data, and we're going to try to report this regularly. It's because we want to show people the value of that vaccine, show the almost immediate value of Manitobans becoming vaccinated. And this is on our way to that post-pandemic Manitoba. So we know some Manitobans are hesitant to get vaccinated. If you have questions, please contact your healthcare provider. You trust them with a lot of discussions and information. Trust them with this. But you can see the incontrovertible evidence of the value of vaccines right now in Manitoba. So I do strongly recommend all Manitobans be vaccinated, those who are eligible, and be vaccinated as soon as you can with both doses. You know, I'm really thankful for the important grassroots works that's happening right now in all corners of the province, trying to reach Manitobans to get vaccinated. And what we see now, the vast majority of severe cases of COVID-19 are preventable. We have vaccine now. We have everything we need to substantially reduce hospital admissions and ICU admissions. And so that's vaccine is that key part of leading to a post-pandemic Manitoba. Each passing day, we see more and more Manitobans protected. We have over 1.5 million doses already provided to Manitobans. And so this vaccination, along with the public health orders, are bringing our case numbers down, bringing down the strain on the healthcare system so that we can loosen orders over time. And again, on that path to Manitoba with public health recommendations, but not orders. That post-pandemic Manitoba won't be reporting on daily case counts. Our healthcare system won't be strained from a single agent. But we have this power to make this happen through vaccination. As announced last week, July 14th, all super sites throughout the province will be offering walk-ins only. So Pfizer will be earmarked for those youth between 12 and 17, and Moderna will be available for adults at each site. So there are a number of Moderna appointments open and available for booking right now. So again, I encourage everyone to get vaccinated with both doses as soon as you become eligible. We still see some strain in our healthcare system. But we see that improving over time with our lower case counts as well as the uptake of vaccine. And so if we continue to get vaccinated at the rate we do, I see us continuing with our plans to reopen and to get to that pre-pandemic Manitoba. So thanks. Happy to answer any questions.
Thank you, Doctor. A reminder to our reporters on the line, you will have one preliminary and one follow-up question. Up first this afternoon from Global News, Marnie.
Good afternoon, Dr. Roussin. Thanks for taking our questions. The Justice Center for Constitutional Freedom says they've been hiring private investigators to keep tabs on government officials. To your knowledge, are you aware of having a PI following you to see if you're following public health orders?
I'm not aware of that specifically, no.
Okay, and in terms of our numbers, with the exception of today, it almost seems like they've kind of plateaued around the 70 to 80 case count daily. What do you make of our current trends, and are you concerned that we aren't seeing consistently lower numbers at this point?
Well, I think, week over week, we're seeing a decline in the numbers, and we're still seeing some numbers up in the 70s and 80s. So, of course, we want to see those drop as far down as we can get them. But we know that with the vaccine uptake that we're getting, we're going to see that, and we're also going to see a decline in severe outcomes. But again, we have to reiterate, we're not done with this virus. This virus isn't done with us. We're dealing with the Delta variant. So we still have to be cognizant of this virus. We still have to take care to ensure we're not having large spreading events. And we still have to ensure that Manitobans get vaccinated at that fast pace that they've been doing up to now.
From the Brandon Sun, Kyle.
Good afternoon, Dr. Roussin. Would you be able to provide any kind of preview for announcements later this week about loosening of restrictions in the province?
Yeah, so not specific. It's sort of in keeping with what we've done is we'll have an announcement later this week with those specifics. All I would say is that it's going to be keeping with our 4-3-2-1 plan, and Manitobans' work has put us in a position to move forward early again with our loosening plans. So details to follow.
Thank you. And I know that the government has undertaken a bunch of information campaigns to convince or to clamp down on vaccine hesitancy. Are you feeling at this point that those campaigns are gaining traction, or do you feel like you guys are bumping up against the wall at this point in terms of convincing people to get the vaccine?
Well, I think there's been great work done. I think we're getting some results. You're going to see, as expected, once you get to the really high first dose uptake, then each percentage point after that's going to be more and more challenging because you do have to reach to the people who have declined up to now. But we're reaching people. And we're going to continue to reach out, continue to show the benefits of the vaccine, and really convince Manitobans that that's our way to a post-pandemic Manitoba.
Thank you.
From CJOB, Rosanna.
Hi, Dr. Roussin. So a UK study is finding a change in the symptoms being reported depending on whether you're unvaccinated or have one dose or two. So can you give us an idea of any changes in the severity and types of symptoms we're seeing in our active cases right now based on vaccination status?
Yeah, so a lot of it is anecdotal from what we're seeing, but we are seeing many cases of very mild respiratory virus symptoms. So simply runny nose, a sore throat. So we are seeing some of that. Of course, we're still seeing the severe outcomes. We're still seeing hospitalizations, ICUs, and unfortunately deaths. But we are seeing that shift to some milder illness, especially in those who are vaccinated. And we know that benefit of a vaccine, right? Nothing we do in medicine is 100% effective. And so vaccines aren't 100% effective, but these ones in 2 doses are in the 90s, which is quite quite great effectiveness. And we know that if people are vaccinated and still come down with COVID, they're much less likely to have severe outcomes, and they're even less likely to be able to be highly transmissible. So there's a lot of benefits to vaccine.
Thank you. So as of yesterday, Saskatchewan is free of COVID-19 restrictions. Are you worried about Manitobans traveling next door, where people can go to nightclubs without masks now? And what kind of advice would you give to those traveling?
In Manitoba, we need to base our public health restrictions on the epidemiology that we see here. So we were late to enter the third wave. So we're late to come out of it. But we've been ahead of schedule for our reopen plans. And so the advice is be fully vaccinated. Those who aren't fully vaccinated are still required to isolate upon their return to Manitoba. So those that are, the advice really is to look at the epidemiology in Manitoba, to largely follow the restrictions we have in place, which we've been ahead of schedule, and we're going to continue to be ahead of schedule in our reopening plans.
From the Winnipeg Sun, Scott.
Hi, good afternoon, Dr. Lucen. Just looking at these hospitalization numbers, so 77% of the 90 cases had no vaccine, 3%. So does that suggest that 20% were fully vaccinated then, but still wound up in ICU? And what would be the explanation for that, if that was the case?
It's much less than that. So we have that, sort of that 74% of them are not even a single dose. 22% had a single dose, but not yet protected. And so into the, I believe it's into the high 80s are not fully protected. So we're seeing very, very few people being admitted to ICU or hospital that are fully protected. That's that 2 doses plus 2 weeks.
Okay, thank you for that. In terms of data of people contracting COVID, even though they either have 1 dose or fully vaccinated, do you guys have that data? Is that readily available to share, or is it not that important, given that it's more important to look at the severe outcomes instead?
We do have that data, and it's much of what we talk about here. It's much well under 1% of our cases are those who are vaccinated, and so it's much the same measures of this. So we feel showing the severe outcomes is much more relevant. We know that vaccines aren't perfect, just like no other healthcare intervention is perfect. So we're going to see cases after vaccine. What we see very, very little of are severe cases after vaccine. And like I say, vaccination also protects against the transmitting to others. So lots of benefits, and we see it probably best demonstrated by showing the very few people who are fully vaccinated requiring admission to hospital.
From CBC Radio Canada, Charles.
Hi, Dr. Robson. I would like to know, do you think Manitobans will need a 3rd dose of the vaccine?
It's early to know. So right now there's obviously discussions on our fall plans. What will our COVID response look like this fall, when we fully expect to see influenza again, RSV again. And so it's going to really depend on the epidemiology. Will a 3rd dose be required? It's possible. Would everyone require it? We're not sure. Will it be just high-risk individuals? So there's a lot of work going, but we're really going to have to see the effects of the Delta variant. What we see with immunity. Does it wane over time, or is it giving us good enough protection?
For Manitobans going to other provinces this summer, besides being fully vaccinated, would you recommend some other safety measures while out in the other Canadian province opening up?
Yeah, and I think that it's those fundamentals that we've been discussing from the beginning, and so those really aren't going to go away. So I think getting fully vaccinated is the newest addition to the fundamentals, and that's probably the most important thing right now. But when you're away, again, stay home when you're ill. I would avoid, large gatherings that have no controls, in them. Washing your hands frequently. Consider wearing a mask, even if the orders don't require it in those jurisdictions. So I think that following the fundamentals, being still aware of COVID, and really that's the path that we're on here, is where we're going to be providing those type of public health recommendations. There are going to be some people who are at risk or who have less tolerance for risk, who will be more careful than others. But the number one step that Manitobans can take right now, whether they want to travel, whether they want to protect themselves, whether they want to protect people around them, is to get vaccinated fully.
From CBC Manitoba, Sean.
Dr. Roussin, have you been briefed by Manitoba justice officials, the police, or other security staff about being followed by private investigators or anyone else of any kind?
Not necessarily being followed. I've certainly had a number of threats, against me and my family that I've been in contact with security and the police, and I've had it followed up. There's been some suspicious activity that have been reported to me, around my house and things that I've been in contact with law enforcement, but not specifically on this topic of a private investigator being hired to follow me.
When you hear that a justice official with the position of Chief Justice of the Queen Bench, who's presiding over a case related to public health orders, is being followed, do you think that has an impact on the efficacy of public health orders and the nature of the debate about it in the public?
I don't think I can, really comment specifically on that. I think that this pandemic has been difficult on, on all Manitobans. Manitobans have lost loved ones to COVID. They've lost loved ones to other causes and not been able to mourn the way they've wanted to. We've had businesses shut down, maybe never to open again. Our kids have missed out on a number of opportunities. So I think it's been really challenging, and I just think that putting Manitoban against Manitoban, isn't our way out of this. It's always been, we've been in this together. We know it's been challenging in many different ways for different people. But where we are right now with the vaccine uptake, Manitobans have put us in the spot now that we're going to be starting to loosen these restrictions, and and that's our path forward to this post-pandemic Manitoba, to this, Manitoba where we don't have Manitobans pitted against Manitobans.
From the Canadian Press, Steve.
Oh, hi, Dr. Roussin. You mentioned suspicious activity around your house. And I imagine you don't want to go into too much detail, but I was wondering if you could tell us what happened and how it felt, and how it felt to have your family there as well.
Yeah. So, I think it was just, I won't go into many of the details, and it's not just a single occasion, but it is to get a call from law enforcement when, at the time I wasn't at home, but my family was. And so, so it's a little bit concerning that way. And again, it's understandable that this has had a huge toll on Manitobans, but, I don't think that, any of us can legitimately accept that threats against someone or their family is acceptable, no matter how much you disagree with some of the protections that we put in place.
Thank you. And I just wanted to go over the numbers you provided at the beginning, because we didn't get these on paper. Just so I understand correctly, and correct me if I'm wrong, but you said 74% of the people admitted with COVID to hospital last month were not vaccinated, and another 22% had one dose but less than 2 weeks. So that, in my math, that's 96% who either had no vaccine or one dose but less than 2 weeks.
That's correct. Yeah, and like I say, is that we're for those that are fully vaccinated, we're seeing very, very few people ending up in hospital or ICU, and so it's really again. When we started speaking about these numbers, we got reports of people making it to ICU when their dose was scheduled the day after they got admitted to ICU. Right? So it's not about blame. It's not about bad decision making. It's just simply to show that this is our way to a post-pandemic Manitoba. And it's putting us in a position right now to be ahead of schedule with that. So that's the reason we show this. And I think we're going to keep showing it until we can get as many Manitobans protected as possible.
From CTV Winnipeg, Michelle.
Hi, Dr. Roussin. We keep hearing, we're headed towards a post-pandemic Manitoba where there'll be just recommendations from public health. What if some businesses are considering keeping a double vaccination policy even after that? Is that something that businesses can do? What will be the recommendation going forward?
So I think we're going to have, as we move into that phase of our reopening, we're going to have more guidance on those specific things. So the idea is let's get as many Manitobans vaccinated as possible so that we can get that population level benefit, right? So we know right now that those under age 12, for instance, are unable to get vaccinated currently. The more people that are vaccinated around them protects them, and if we have all doubly vaccinated people around them, those doubly vaccinated people are protected too. So you can really see that the population level benefit. So we do want to get to a place where this pandemic is behind us. It's not going to be COVID isn't going to be behind us, but the pandemic is going to be behind us. And we want to get to that point where we have recommendations, but not orders.
Thank you. We're also hearing from the World Health Organization today that mixing vaccines is a concerning trend. There just wasn't a lot of science to back it up. Are we going to relook at that, or what will public health do with this statement from the WHO?
Well, I think we will always be looking at evidence as it comes out. I think the evidence that we've seen to date is that there's the efficacy of mixing doses is the same, and in some instances we've seen it even better. We know that in the past with vaccines we use them interchangeably on many other different viruses that we vaccinate against. So. The basic premise of interchangeability of vaccines is there. And we've seen some evidence here of that it's at least equal or perhaps even better in some circumstances. So we'll continue to look at the evidence as it emerges. But for right now, our message would be to get vaccinated as soon as you become eligible.
From CHVN, Taylor.
Good afternoon. Back to the threats. How often have you been getting those?
I think email type threats, or at least low level threats were pretty common throughout all the phases of the pandemic, and that was probably daily or at least weekly. But during this third wave, things have been stretching out. So I've been getting, more and more severe ones that have been reported to me that people have seen in social media that have had some law enforcement involvement in it. So it's troubling to see that. We've all been working hard for it, and to just try to get to this, to where we are now. We're able to loosen some of these restrictions, so hopefully those threats too are going to be a thing of the past.
Along the same lines, in a lot of Manitoban families, social circles. There's a lot of tension between vaccines and those who aren't vaccinated. As things reopen and people start to gather in different ways, more of these kind of confrontations are going to happen. How do you suggest people talk about the topic of vaccines and socializing?
Yeah, so I think that we're getting to most Manitobans. We're getting very high vaccine uptake. We need more, but we're certainly getting there. And I think this is along the same lines of what we talked about with that post-pandemic Manitoba. This is going to be where people's risk tolerance is, and so there might be some people whose risk tolerance, doesn't allow them to be around a large number of people who are unvaccinated. My advice is really just to the advice of what we've been giving here is if there's someone you care about who doesn't want to get vaccinated, I would suggest they speak to a healthcare professional just to get further advice on that. Again, we're not putting Manitoban against Manitoban, but we do want to show the value of that vaccine. And how it doesn't just protect you, it protects everyone around you. And we're starting to see that now. We're starting to see these numbers come down. We're starting to see hospitalizations come down. And that's because of vaccine. And that's going to be that path moving forward to lifting these public health orders.
Our final reporter this afternoon from the Winnipeg Free Press, Danielle.
Hi, Dr. Rusin. Returning to the question of daily case counts, is the average of about 70 cases a day and a test positivity rate at about 5% favorable to take the next step in the province's reopening plan, move toward 50% capacity across all health regions?
Yeah, I think that given those numbers, given the trend, and then add to that the vaccine rate, the protection, then yes, then I do think we're in a position to continue to move forward with our reopen plans. And I do think that we're going to be able to do that province-wide. But again, that strong evidence is shown here, and we're going to keep showing it and keep showing it to Manitobans that the vaccines are highly effective, especially at keeping people out of hospital.
Thanks. And was supposed to say, are you and when you project?
Sorry, there you're cutting out. I didn't catch any of that second question.
Okay, I'll try again if you can hear me now. The Delta screen, it was supposed to be in place last week. Are you going to screen all the unspecified samples for the variant? And when do you project it may become dominant in Manitoba?
Yeah, so we're on that way. I don't believe we have that ability to screen them all right now for Delta, but we are on the path to be able to do that. And so right now, certainly Alpha is the dominant strain in Manitoba, and we're seeing that as in the severe outcomes as well. So it's difficult to predict. We're seeing our case numbers declining at the same time as vaccine is climbing. So we do see in other jurisdictions, once Delta is there, we're going to see that become the dominant strain. But it's really difficult to predict when that would occur.
Thank you, Doctor. Thanks, everyone. This concludes our media briefing.